Hi, my name is Nolan Carnes, and today I'm going to talk to you about C4 brand pre-workout supplement. C4 Extreme is a powdered energy supplement distributed by the company Cellucor. Cellucor sells many different types of performance-enhancing products, including whey protein, branched-chain amino acids, creatine, and other pre-workout supplements. C4 is their most popular brand of pre-workout supplement. The C4 Energy Boosting product contains many different ergogenic aids within the supplement. The largest components of C4 are beta-alanine, creatine nitrate, and their explosive energy blend. C4 is claimed to ignite your mind, muscles, and workout regimen, workout after workout after workout. C4 is a blend of many different ingredients. Vitamin C, 250 mg, calcium, 28 mg, niacin, 30 mg, folic acid, 250 micrograms, vitamin B12, 35 micrograms, beta-alanine, 1500 mg, creatine nitrate, 1000 mg, arginine AK, 1000 mg, and an explosive energy blend totaling 741 mg, which contains ascorbic acid, N-acetyl-L-triosine, caffeine anhydrous, 135 mg, mucuna purines, bitter orange, niacinamide, folate, vitamin B12, and pyroxidyl 5-phosphate. Other ingredients include natural and artificial flavors, citric acid, malic acid, silicon dioxide, calcium silicate, sucralose, acesulfame potassium, and red lake 40. The serving size for C4 is 1 scoop, which equals about 5.7 grams. There are 30 servings of C4 in one container of the product. The instruction label suggests that to determine tolerance to C4, 1 scoop should be mixed with 4 to 6 ounces of water 20 to 30 minutes before exercise. After a personal tolerance is determined, the consumer may take up to 2 scoops 20 to 30 minutes before exercise, and it should be diluted with 4 to 6 ounces of water per scoop. C4 contains a warning label with various precautions that should be taken while using the product. C4 should not be used in conjunction with nitrates for chest pain or medicines used to treat erectile dysfunction. It should not be used with over-the-counter medications or pre-existing conditions such as high or low blood pressure, cardiac arrhythmia, stroke, heart, liver, kidney, or thyroid disease, psychiatric or epileptic disorders, diabetes, recurrent headaches, enlarged prostate, difficulty urinating, glaucoma, or if MAOIs, antidepressants, aspirin, NSAIDs, or products containing phenylephrine, ephedrine, pseudoephedrine, or any other medications are being taken. There is a warning that the product contains caffeine and should not be taken with any other food items that contain caffeine. There is also a warning that reassures users that the product is made with all legal dietary ingredients, but some may be prohibited by individual sports. Although there are no specific research articles that focus on the C4 brand pre-workout by Cellucor, there are numerous articles which test similar pre-workout blends. A study done by Shelmadine et al. 2009 tested NO Shotgun brand pre-workout and concluded that no adverse side effects were seen, and that it helped increase muscle strength and mass, myofibril protein content, and increased satellite cell activation. Smith et al. 2010 tested the effects of Game Time pre-workout and concluded that it caused increases in VO2 max, critical velocity, and lean body mass when combined with high-intensity interval training. Bloomer et al. 2010 tested Glycocam brand pre-workout and concluded that it did not provide an increase in blood flow or acute upper body exercise performance. Spradley et al. 2012 tested Assault brand pre-workout and concluded that it provided significant agility in choice-based parameters while increasing lower body muscle endurance and increasing perceived energy and decreased subjective fatigue. The different pre-workouts contain similar ingredients to those in the C4 brand pre-workout. C4 is a combination of many different types of ergogenic aids. This makes the pharmacokinetics of the pre-workout difficult to distinguish. To better understand C4 brand pre-workout as a whole, the major ingredients of the blend must be considered. The that can be achieved about C4's pharmacokinetics is by looking at the label and the suggested times for servings. The administration of C4 is enteral. C4 is mixed with water and ingested orally. C4 seems to be metabolized and distributed through the body by the liver, which causes its systemic effects on the body. C4 has a powerful influence on the central nervous system. This is what gives C4 its stimulating effects. Based on the chemical properties of C4, it can be hypothesized that C4 is excreted mostly through the kidneys, although the exact percentages are unknown. The usage directions for C4 indicate that it should be taken 20 to 30 minutes prior to exercise. It can be assumed that peak levels of C4 are achieved at this time. This means that the half-life of C4 is somewhere in the 20 to 30 minute range based on the individual. There are no specific side effects from C4, but there are anecdotal stories and evidence of side effects based on similar compounds. Anecdotal evidence for side effects comes from a supposed tolerance that can be built against the substance. Users report that after extended use of C4, they no longer feel the same amount of alertness as they felt when they first began using the substance. This causes the user to take more than the recommended dosage in order to achieve the same effect. C4 can have an addictive effect as well. Some ingredients in C4 mimic the effects of amphetamines. Users report that once they stop using C4, they become less aware during their workouts, and that their workouts suffer because of this. Other possible side effects can be noted from the various components of C4. For example, beta-alanine, a major component, can cause flushing and tingling when high doses are used. Creatine nitrate can cause stomach pain, nausea, diarrhea, and muscle cramping. Finally, the caffeine content of C4 may cause some discomfort. C4 contains roughly 135 milligrams of caffeine, which is equivalent to the caffeine content in about 12 ounces of black coffee. One ingredient in C4 has been known to cause problems when taking drug tests. This chemical is known as 1,3-dimethylalamine. 1,3-dimethylalamine is a chemical that is made synthetically in a laboratory. It is thought to have come from rose geranium oil. 1,3-dimethylalamine has the qualities of a stimulant and is thought to be similar in structure to amphetamines. The structure of 1,3-dimethylalamine is also very similar to the drug Adderall. For this reason, C4 may cause a user to test a false positive for amphetamines. In 2012, the Navy Drug Screening Laboratory in Jacksonville, Florida, released a position statement saying that the use of C4 Extreme may cause a false positive on drug tests, and that people in the Navy should report if they are taking C4 when administered the drug test. C4 Extreme itself is not banned by either the NCAA or WADA, but particular substances in C4 may cause a positive drug test. WADA states that the use of stimulants during competition is legal. However, the use of them is not illegal when outside of competition. WADA states that the use of dimethylamphetamines is illegal during competition. Because the substance 1,3-dimethylalamine in C4, it is suggested that C4 should not be used during competitions governed by WADA. WADA contains a general ban against all stimulants with D isomers, which C4 contains. The NCAA states a general warning against all nutrition and dietary supplements. Their warning is that if a supplement causes a failure of a drug test, that it is the responsibility of the athlete. The NCAA bans stimulant-type drugs, including the drug Adderall. 1,3-dimethylalamine is essentially the same in structure as Adderall. C4 also lists caffeine as an ingredient. Caffeine is listed as a banned substance by the NCAA. Because of the 1,3-dimethylalamine and caffeine found in C4, it should not be taken when participating in sports governed by the NCAA. C4 is a popular brand of pre-workout supplement. C4 is a product that is useful for those who are working out as a general population. It provides alertness during exercise and helps to achieve better feelings during workout. C4 is safe to use, but as with any ergogenic aid, it should be used carefully. C4 may be useful for athletes during their off-seasons, but due to its chemical ingredients, it should be avoided during the in-season. By following the labels provided on the packaging, C4 can be used to better workouts for those who are looking to gain an edge.